thanks for having us down. I just wanted to really, first of all, thank you for the extraordinary work you're doing. Let you know that we have some real challenges, as you know, in the state, and we're tackling them. But we do have a comprehensive plan to create jobs and put Vermonters back to work and make Vermont more prosperous, including Southern Vermont. Now, you have every reason to distrust government, and you have every reason to distrust health care reform from government. All I ask is that you join us at the table to give us a chance, because I say that if we do not fix the system, small hospitals like this will not survive. Rural health care providers will not survive.
Governor, just, the people in this room here have, well before I arrived, have embraced change. This hospital led the way in the blueprints. We led the way in medical homes. So this is not an audience that's not afraid of reform. I mean, I think they've embraced it. We're looking at affiliations right now. We've gone through a lot of trauma. We lost a tremendous amount of money. 100 people laid off. Massive cuts in benefits. Other benefits to our employees and doctors. What we're afraid of, I guess, is, again, the bridge. The bridge to change. Something like the provider tax devastates this organization. We're probably on a per-bed basis the highest hit in the state. So the concern is not changing, it's how do we make the change work, still provide the type of care, Magnet Hospital, on all the indicators is one of the best in the state. So that's what we're imploring in terms of how can we make this change that's going to allow us to survive to a new future.
Well, obviously we want to work with you in the transition, and I've been a governor for 8 weeks, and I inherited the system that you're stuck with, and I cannot deny that we're not asking more of you in the short term. We are in our provider tax recommendations, provider fee recommendations, but all I can say is I think that the beauty of organizations like this is that you are willing to reform. And I might point out that I think reform in healthcare is going to come from the small states and from the small organizations like this, because we have no other choice. The fact of the matter is we're losing our small rural healthcare providers, and we're losing our small hospitals. And frankly, the big hospitals might want to stick with the system we got for a while and hope that maybe some of the small ones don't make it. Let's be candid about this. So we're in this together to keep you strong and to keep you healthy. And it's not easy. And I understand why you have a lot of fear. And all of the reasons that Tom just outlined are all the reasons why we distrust the current system. All I'm saying is we need you to come to the table with us to try to design a system that's different than the other 49 states, that you can trust, and that reimburses you for the hard work you're doing. And I think we can do it together.